So yes, Chair, Vice Chair, and the board, we do have an update as it relates to the federal shutdown. A lot of volatility as it relates to programming and funding and changes. Some stuff we actually received today as it relates to percentages in regards to FNS. And so the budget team, as well as public health and also public and social services, will come before you to talk about the federal shutdown and also its impact, particularly as it relates to safety net services.
Good afternoon, Mr. Chair, Madam Vice Chair, members of the board. So we've got a couple of different staff members today to give updates on the federal shutdown. Information is changing daily. We're continuing to monitor that. We've got a group of countywide staff that meet on a weekly basis to do updates by department to understand the operational impacts, but also we're getting updates on a daily basis as information becomes available. So today, Haley Matthews, our budget manager for grants, is going to walk through some of the overview. Then we've got Sharon Barlow from DSS, Courtney McFadden from Public Health, and then Heather to talk about the food security efforts and our One Guilford approach. And so we'll go through those updates and then have any questions from the board.
Thank you, Toy. Good afternoon, Mr. Chairman, Madam Vice Chair, members of the board. Thank you for receiving our update today. Let me go ahead and change our slide. Perfect. So a few objectives we have here today. The first one is to provide an update on the federal shutdown, provide an update on impacted programs, and then also to discuss funding options for WIC after November 30th. Our most recent guidance tells us that WIC is funded through November 30th. So Courtney will provide an update later in our presentation. We're going to go through before our directors take over their subject matter expertise and just define some definitions. There are a lot of information out there right now, and you hear a lot of these terms, but they're not always clear. Oh. There we go. All right, so what is a federal shutdown? So a government shutdown happens when Congress fails to pass funding bills or a continuing resolution. It's referenced a lot of times as CR. To authorize federal spending. Without funding, many agencies must suspend operations. So how are we impacted as the county? So we are responsible, as you know, for administering federally funded programs, particularly in our Health and Human Services Department. So reimbursement for some of those programs may be delayed. There's some other impacts we're experiencing in the FNS, also known as SNAP world, and WIC as well. So the county, we're continuing to work with our state partners who disperse funds to us, but also our local partners. Currently, us as staff committee, we hold weekly meetings to go over these updates, but oftentimes we're talking on a daily basis. As Mr. Manager said, we got some updates right before this meeting that changes some of the information you'll hear later in the presentation. So it's kind of a day-by-day, minute-by-minute situation that we're tracking, and we are compiling all of those resources we receive from the state, USDA, and our local partners in a central source for staff to be able to review. And how are our residents impacted? So this is the most impactful questions that we're asking. So currently, the two programs that are now having impacts or could in the future are our Supplemental Nutrition Assistance Program, SNAP, known as FNS in North Carolina, and then our Women, Infants, and Children program, which is WIC. So we are going to move to provide some updates from our departments. So I'll turn it over to Sharon Barlow, Director of Social Services.
Good afternoon. Oh, I have to, let's see. So we've talked a lot about SNAP, and you know that the SNAP program provides low-income households with monthly benefits. And eligibility factors are household size, income, those types of things. So when we prepared this, the Department of Agriculture had issued revised table of FNS benefits to reduce November benefits to up to 50%. While I've been in the room, we received an email from NCDHHS that appears to be good news, and that we're pleased to share positive development late last night around 10 p.m. North Carolina DHHS and other states were directed to issue November benefits at 35% of the maximum allotment instead of 50% reduction. So that seems to be good news. We have not received the Deere County Director letter, which is our, in essence, marching orders for how to do that. We should receive that either later this evening or tomorrow. Some things to remember is that November benefits, the amount a household receives will be less than normal. Some households that normally have very small benefits, $27 is the smallest amount, may not receive anything. That's the direction we've gotten right now. That was different than the direction yesterday. So take that with a grain of salt until we receive the final. All of the November partial benefits are being sent at once. So most households will likely receive their benefit at a different time than they're used to. Again, that is different guidance than we received yesterday. We do not know if there will be any additional funding from USDA for November benefits. So that was as of a couple hours ago. We do anticipate receiving something either later this evening or in the morning about that, what that could possibly look like. Oh, here we go. Just a few things. We've talked a little bit about these numbers just in the past 6 months. We've averaged around 41,845 households receiving SNAP benefits, and that's about 2 participants per household on average, so about 85,355 citizens that receive this benefit. Our monthly average issuance for the past 6 months was 15.4 million. And it does impact over 500 local retailers, and that's a pretty significant economic impact. Currently, county staff supporting this program receive 50% reimbursement. We talk about that a lot when we're talking about our FTEs, and we receive about 50%. We believe that that will come back into play as soon as the shutdown is over. We have been directed to continue all normal applications. We must continue to take applications, including expedited services. We must continue to complete recertifications, all on normal schedule and meet all timeliness criteria. This was the direction that we had received about SNAP issuances. Typically, they're issued based on the last digit of your Social Security number. The guidance we received just a little bit ago is that they will be released at once. So I don't know whether that will change or not, but that was the guidance. And that's typically how benefits are released throughout the month. Currently, there's sufficient budget authority and cash flow to continue operations, and there is no budget action needed at this time. So I'm happy to answer any questions about SNAP before we move to WIC.
Questions, Mr. Duke?
And this probably apply to both programs, but if that 50% reimbursement is not received, what is the anticipated impact to us from the county on a cash flow standpoint to cover those individuals?
So we do have those projections, Commissioner Perdue. What we do know is we have the cash flows to support us. However, you're right, on a monthly basis, we do submit the 1571 for child support as well as for social services. That 1571 report then moves forward with us getting reimbursement throughout the year. We have considered where are we with our cash flows, and so at this point in time, as we work through our reimbursement schedule, we do feel like we have adequate cash flows, but I will allow our team to follow up with you with the details of that, particularly as it relates to FNS and Medicaid and child support around where we are with their needed reimbursement on a monthly basis. But our cash flows right now will hold us.
Yeah, it's $460,000 is a monthly reimbursement on FNS, and WIC is 225,000. Right, operational.
All right. Anything else, Mr. Purdue? Ms. Cook?
Thank you. Sharon, will you just repeat what you read in the email about the new tentative direction? It was 35% reduction? Is that what you said?
Right, instead of 50% reduction, it'll be reduced by 35%.
Okay, thank you. And that funding is coming from USDA, like the normal funding source, or is that North Carolina filling in some gaps?
It appears that it's coming from the USDA.
Okay, thanks.
Ms. Foster?
Kind of a follow-up to Commissioner Cook's question. So prior to today, that the benefit reduction was 50%. So those households that were scheduled to receive their benefits on the 3rd, the 5th, and the 7th, was theirs 50%?
They have not received
They
those
did
benefits.
not receive.
No November benefits have been received yet.
paid. And you don't have a date as to when they will be paid?
We have, they indicated it could be as early as tomorrow.
Okay, and the $27 benefit, I think in my space and people that I deal with, is usually seniors
Correct.
that receive that $27, and I know that some seniors only get like $10. So you're saying they probably will not receive anything?
What we thought yesterday was that they would receive 50%. What this directive says is that some households that normally have smaller benefits may not receive anything. I don't really have any context for that, but I will, as soon as we get the DCDL, the Deer County Director letter, as soon as that comes, I anticipate that that will have more specific guidance.
And so how are households advised of this reduction? Do they just go with their EBT cards and just know that, oh, it's less than what I normally get? Or is there some communication that they receive?
The state communicates out through text and robocalls to the beneficiaries. I do not believe that this has been communicated yet.
Thank you.
Sharon, would the fee, the amount that they receive be prorated, or would it be backdated retroactive to November the 1st?
It will be November benefits, whatever they're eligible for in November. That's the starting amount, and then they'll use this formula.
Okay. Reduction of 35%, not 50%. All right.
That's what I believe.
Other questions? Anything else? All right. Great, with Wick.
Good afternoon. Oh, sorry.
Okay, let me go.
Good afternoon again. We'll just provide a quick update on Support Our Pantries. So want to recognize the press conference that happened last week and the support that the board and the chairman have provided to our pantry partners. We know that there's a county response to this situation, but there's also a lot going on in the community with our partners around food security and making sure that people have access to food. Staff, what I will say at this point is that staff from multiple departments have been involved in the response. And so everybody from coordinating with Sharon's team, as well as emergency management, the budget and management services team, cooperative extension, and even the IT and GIS staff who have created a GIS map for the website with locations of food pantries in the community. So what are we doing with this One Guilford Support Our Pantries initiative? A couple of key points, things that we are doing is communicating regularly with our food pantry partners. So making sure there is a structured weekly call that happens, but there's also open communication with our pantry partners in Greensboro, High Point, and the outlying areas to make sure that we understand what is going on the ground, as well as what their needs are and how they're responding. And so we are also getting data from Second Harvest weekly, and so we will share those with, I've got some to share today, and we will continue to share those updates. We are using data to ground our conversations, both internally with staff and with our community partners. making sure that we're thinking about both the quantitative data, so that's a lot of that is coming from Second Harvest and the data that they collect from their partner agencies, as well as qualitative data that we are getting through those weekly updates with our community partners and our food security partners on the calls. We are gathering data and we are sharing data, and I think that's the other key piece of this work is making sure that we are, being good stewards of information and being trusted partners as we are doing this work with the community. We are providing information, community information through the website, and we are committed to transparency. So a few ways that we're doing this is we're keeping residents updated. We have a county webpage that's been created, both a couple of pages, one around food access, so making sure that people can access the Greater Guilford Food Finder app, as well as providing information about how to about the number of households impacted and then how to support local pantries. And then we are supporting local food assistance efforts. Part of this is by sharing information with food pantry partner or about what our food pantry partners are doing and how the community can both support pantry partners, but also how people can access food through those same partners. And then sharing, again, just sharing resources. You'll see the QR code up here. What we do know is that our pantry partners are seeing about a 25% increase in demand. They are able to handle that. They're responding to that, and they are meeting that need at present. They are working closely with Second Harvest to do that. About 36% of their clients are under 18, and about 17% are over the age of 60. And then as far as specific dietary needs, because that's one of the considerations and how our partner pantries are responding, about 9% are responding to food requests for diabetic patients, and then 14% of the food assistance is supporting clients that have some sort of heart-related condition. And then you'll see that I think there's a handout packet that you have already. It lists our largest food pantries, food pantry partners, as well as the top zip codes that residents are coming from as they access food at these pantry partners. And I will say those zip codes have been consistent both prior to this situation and then after the situation. Largest pantry partners are Backpack Beginnings, One Step Further, Out of the Garden Project, and those three serve county-wide audiences, as well as then West End and Open Door, specifically in High Point, and then Greensboro Urban Ministries in the Greensboro area. And that's where they're based out of, but recognizing that clients can come from beyond those borders as well. And all of those are Second Harvest partner agencies, so we have data that's coming in from all of those. And I'll just pause there.
I do want to add to the board the importance of the One Guilford Support Our Pantries initiative and being really clear that we're working with Second Harvest and also with their pantry affiliates. When you look at the gap that we're trying to close on a 30-day basis, that's $15 million. And so our pantry partners, along with Second Harvest, have created a Fill the Gap initiative to make sure that people can engage in multiple ways. You can volunteer at a pantry because the demand is high. You have pantry staff that's been in this prior to this circumstance, and they're now working 12, 16-hour days. And so ways to volunteer is extremely important. You can also, through the campaign, give and make monetary donations, but then also plug into a site where you can bring material good. And so it is multifaceted, and we want to continue to support our network in Guilford County that's aligned with Second Harvest. We can also look at first-time users and reoccurring users of the service, so then we can think and align with how do we further leverage wholesale product and food to then move forward as this may come more pervasive. And so we want to make sure that we're really aligned well with this data so we can think about decisions as a community. And so just want to say thank you to the staff and the team for helping putting this framework together.
Great work. Now, all this is listed on our website also. All the available pantries that people can go to. They can go to our website, get that information, find out which one is closest to them, and the hours that they're open and things of that nature.
Correct. The Greater Guilford Food Finder app is listed, and that is up to date, as well as our GIS team created a GIS map, so you can visually see throughout the county where food pantries are located. And we're working with our communications team to continue to have a process to update and share information, because we know it continues to evolve.
And Mr. Manager, I want to commend your staff for taking on this task. At short notice, and it's been very, very efficient and responsible for our citizens to be able to get access if they need it, and to give them the details on how they can get it. So,
Yes, sir.
hats off to your staff.
Thank you.
Thank you.
Any other questions, you all? Comments? All right, thank y'all very much. Mr. Manager.
So we do have some information as it relates to WIC.
Oh, Wick, I'm sorry. Trying to move right along. Cutting your time short.
All right, good afternoon, everyone. The WIC program provides healthy foods, breastfeeding support, and nutrition education to about 13,000 county residents and women, infant, and children up to age 5. The monthly WIC benefits that I receive by county residents total about $1.2 million each month. The latest update we have from the state is that with spending continuing at its normal rate, we will have funding through November 30th for WIC operations and for benefits. We are communicating with our WIC participants that WIC is still open and operating as usual. Participants should be assured that the operating hours of our clinics remain normal. Our clinics are open and there are no services being cut back at this time. No appointments are being canceled. And with transactions at the grocery store will still be processed normally. Should the shutdown continue, the additional funding that would be needed post November 30th. The county staff, the WIC county staff, are supported by 100% of the federal funding that's passed through the state. There are no county funds that are supporting the WIC staff. We have about 35 WIC positions, and that operational cost is $225,000 per month. We have identified some additional federal funding, about $400,000 in our what we call FIG, our Public Health Infrastructure Grant, that we, if needed, could use to support WIC positions for 6 weeks post November 30th. And we will have the county's administration staff bring this item back to the commissioners to approve the appropriation of the additional $400,000 in federal funding if needed beyond November 30th. And this is just a table of the impacted staff. We have 4 staff that will remain working in WIC in those 6 weeks if needed. The other staff will be assigned to other public health projects or tasks temporarily. And this just gives a summary of that. Any questions about WIC?
I actually just have a clarifying question. So I thought you were saying that the cost to pay the staff after November 30th for 1 month would be $225,000, and that is to cover 34.75 FTEs.
Correct.
But it looks like the plan is to reassign most staff. Am I misunderstanding? And so then there would only need to be funding to pay 4 positions, or?
If WIC funding is not continued through the state after November 30th, we would not be able to have the vast majority of the WIC operations that we have now continue. So they wouldn't be able to process applications or accept appointments. And so there would, for lack of a better word, be not a lot of WIC work that they could do, especially if the database from the state is shut down. And so our plan is to reassign those staff to other public health tasks or functions within that 6 weeks with the alternative federal funding.
Okay, and so there's not currently funding associated with the reassigned positions either, and so the cost would still be the full amount and not a reduction to the cost of only the 4
Correct.
positions.
Correct.
Okay, thank you.
Ms. Foster.
I heard that. So any positions that are reassigned will still be paid with WIC dollars?
No, they will be paid with the alternative federal funding, the Public Health Infrastructure Grant
The
dollars.
$400,000
Yes, ma'am.
is what you will be paying WIC positions in that will be reassigned to
Yes.
other.
Yes.
So, yeah, okay, so, I mean, that does make sense, but I know we're trying to get, through this, but I just want to share that, unless you're really close to this or know people that receive WIC, then you don't know the impact. I was in the grocery store last Sunday behind somebody that had a buggy full of WIC stuff. And when she got to the end of her checkout, she didn't have enough WIC dollars to pay for all that she had. So she was standing there trying to take things out of her budget, out of her buggy. But because I was behind her, I just said, leave it and just add her balance onto mine. So that really opened my eyes to, I already knew the value of the program, but seeing somebody really in the grocery store who can't afford to pay a little bit of money out of their pocket to get the things that they need for their families was just really, really disheartening. So I guess it is all of our hope that we will get sufficient dollars beyond November 30th, because these WIC dollars have already been allocated and people know that they can go to the grocery store
Yes.
and use them for November, but none of these federal dollars, because they wouldn't even start to touch what we need to be able to continue the WIC benefit. So it's really, really,
Correct.
really challenging.
The 400,000 would continue our staff costs,
Right.
but if the government is still shut down and no additional funds from the USDA to the state is received, there will be no benefits issued to WIC
Yeah,
participants.
but you're gonna come back to us
Yes, ma'am.
with that information.
Yes, ma'am.
Thank you.
Any other questions? All right. All right, is that it?
Thank you, Courtney. I think we lost our slides for a minute, but I'll quickly go through some other programs. These are all DSS-related programs that currently have no impact, but we know that constituents are asking questions, right? So we want to give you good information. So I'll go through these quickly so we can get to HR's presentation. Maybe. Arian, do you mind going to the next slide? Okay. We might be frozen. Okay, here we go. Thank you. So adult daycare and in-home aid services, we recently got an update about this program. Originally, we thought we would receive our state allocated funding, but we would have a delayed reimbursement with our federal allocation. PTRC is our partner in that. They disperse the funding to us, and they have reported no delays in federal funding, so that's great. So no impact to report at this time, and no budget action needed. Medicaid administration, this is one we've gotten a lot of questions about. So currently the appropriation for Medicaid at the federal level is through December 31st, 2025. It was passed in a separate CR during the summer, the one big beautiful bill. So currently no budget or cash flow impact for this. And finally, adult and child protective services. So we've been told through the state that operations will continue during the SLAP and appropriations since the awards were allocated prior to 10/1/25. So also no impact to this program. And the last slide we have here is just the collective potential impact that we could realize. So $222,000 per month for the adult daycare and in-home aid services is what we're typically reimbursed. Currently not reporting a delay in reimbursement there. F&S, the $460,000 that Sharon mentioned, that's 50% that would get reimbursed. So our total budget for that is usually over $1 million. And then finally, the WIC program, which is $225,000 per month, and we're funded through November 30th on that one. So, any questions about our other programs or our final totals?
All right, thank you very
All
much.
right, thank you.
All right, Mr. Manager, you have to give us your